My name is Ariane, and I'm going to be the preceptor.
And my name is Stephen Taylor. I'll be the junior student.
Our scenario is going to be a junior who is doing a LAP API, and I guess you're in your first semester.
Mm-hmm.
Okay, perfect. Okay, Stephen, so it looks like the day is wrapping up here. You did an awesome job.
Okay, thank you.
I just want to kind of go through your daily evaluation with you.
All right.
So your setup was excellent. I really liked the way that you had the appropriate ET tube chosen, the appropriate OPA. Many students will just have multiple out, and I think that it was really showed evolution in your training that you were able to have one of each thing in a very clean and concise setup. I also really liked your care plan.
Thank you.
I felt like it really incorporated this particular patient rather than just being a general care plan. Right. Is there anything in the care plan that you felt maybe didn't go as planned?
Well, maybe just a couple things as far as the anesthetic plan. I knew it was going to be general, most likely with an RSI induction, but just some of the specifics about which antiemetics that you like to use at the end of the case and things like that. That was really the only thing that
I appreciate you asking me what I like to use, but I just want to reiterate that ultimately you're here to learn to be a clinician in your own right. So what do you think would be appropriate?
Well, definitely Zofran and Decadron. That's what I would use for this
perfect.
patient.
And some people may give other things. Maybe they give Reglan, maybe they don't give Decadron, but you're not wrong as long as you have a rationale for everything you're doing.
Okay.
So your setup was excellent. Your care plan was great. The way that you evaluated the patient when we came in and the way that you presented the patient to me was also excellent.
Thank
I liked how you had done your head-to-toe assessment. You hit all of the really important points when you were giving me a report. So that was great.
Thank you.
Now, as far as the actual case itself, we ran into a little bit of a complication or sometimes an expected side effect of insufflation. So you want to just kind of talk about why you chose to treat it the way that you did?
So I noticed that when they were insufflating the area that they were going to, the area around the appendix, I noticed that the patient became bradycardic, fairly bradycardic in the 30s. So my first thought was to stop, remove the stimulus, because they're stimulating the vagus nerve. And that's what was causing the bradycardia. So I asked the surgeon to stop first, and then while he was doing that, I grabbed the Robenal just in case that didn't respond to that.
And I really liked the way that you had the Robenal ready, but you didn't give the Robenal. That was great because you saw that just discontinuing the stimulation would resolve the problem.
Right.
So it was good that you were able to see that and that you were not afraid to speak up.
Right.
And so that was excellent. As far as all of your skills are concerned, your intubation, today you decided to use a Miller instead of a Mac, which I thought was great. You feel comfortable with the Mac, you want to push yourself to get comfortable with another blade. How do you feel with the GlideScope?
I really haven't used it a whole lot, so maybe in the future that would be something that I could do more of, even if the patient isn't necessarily difficult airway that would necessitate a GlideScope intubation. I think that I could still use it on an easier patient just to practice. That way, when I'm in a situation where the patient is a difficult airway, maybe needs another adjunct rather than just a regular DL, then I could be more confident with the GlideScope.
Right. So when you really need it, you're already comfortable. Those are the perfect patients to practice on.
Right.
What about a bougie? Have you used?
I never have. No, that would be another one to probably use.
So maybe next time we work together, one day we could use the bougie and one day we can use the GlideScope.
Excellent.
I also saw that you took it upon yourself to start the IV this morning. You did a great job. You have a lot of experience with IVs.
The nurses were kind of busy, so I just thought that it would be better to help out rather than.
And that just brings me to my next point, which I gave you a great mark here on teamwork because the nurses actually took me aside and commented on the fact that you saw how busy they were and that you became involved. So that's awesome.
Excellent.
It's great to kind of take that upon yourself to just be a part of the team.
Right.
So for the induction, I noticed that because this patient was older, in her 80s, you chose etomidate. I thought that was a good choice.
Right.
What was your rationale?
Well, she does have a history of peripheral vascular disease, and I know, and also some kidney issues. So I know that given those two things that I found in her pre-op assessment, I know that she probably has some sort of underlying cardiac disease. And it's an emergency case, so we didn't really have time to do a full workup workup as far as cardiac goes,
Right.
pulmonary goes.
Right.
So I thought that it would just be better to use something that's more hemodynamically stable agent rather than propofol.
Excellent.
For her.
I thought that was a really great choice, and your rationale was perfect, which is why we moved forward with that.
Right. Okay.
And your documentation was pretty good. You need a little bit of work on that.
Right.
I know you're getting used to Epic.
Yeah, just getting used to the charting,
Yeah.
I think is.
What are you more familiar with? What charting systems?
I've used Cerner before.
Yeah.
So it's different
Yeah.
than Epic is.
So it'll just take some
obviously.
time,
Right.
and that's the least of our
Mhm.
concerns. You have plenty
Right.
of time to learn how to do that.
Okay.
So overall, I'm going to give you really just satisfactory in everything,
Mhm.
and then just make a couple comments here about the things that we've talked about just kind of maybe pushing yourself a little bit further in terms of your airway management on the next time we work together with the Glide Scope and maybe the
Right.
Bougie.
Okay.
Okay.
Excellent. Thank
So I just
you.
have a couple questions for you. Is there anything that that you think that you could have done better today? Anything that
Well, I
you're
just
gonna go home and think about?
just getting my skills down. You know, it took me
Yeah.
a minute to get the intubation, but you know, once I asked someone to put cricoid on, I could see the cords
Mhm.
right away, and so I think
Mhm.
just getting the right positioning, and I was also using a new blade,
Right.
so that was kind of a challenge as
Yeah.
well. But I think just more time,
Mhm.
more practice.
Yeah, that's what it's gonna take. And then remember too, when you're doing cricoid, instead of asking someone to apply it, you can always do it yourself, which will come with
True.
time
Right.
because you're still getting used to it, especially with the new blade. But then
Right.
remember, you can always kind of reach around and manipulate on your own.
Mhm.
But that'll come with time as you become
Right.
more comfortable. And
Okay.
you have plenty of time in this program
Nice.
to work
Thank
on
you.
those things. Are you back tomorrow?
I am. Yes.
Okay.
Mhm.
Are there any cases that you feel like you need to practice on, or any particular patient population?
I
any
actually